On such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone. Happy Thursday. Welcome to You and Your Doctor, sponsored by All County Healthcare. All County is a Medicare certified home health agency. You can contact them at 954-717-7027 or info@allcountyhealthcare.com. I am your host, filling in tonight for Louise Gomez. I am Dawn Graubert, and I'm very excited and happy to be interviewing Dr. Harris Gellman today of Baptist Health Orthopedic Care. It's been a minute since I filled in for Louise, so have a great evening. Sit back, relax, and let's get into it. Dr. Gellman is a board-certified, fellowship-trained orthopedic hand surgeon at Baptist Health Orthopedic Care. He treats complex elbow, wrist, and hand conditions, including arthritis, carpal tunnel syndrome, fractures, tendon and ligament injuries, trauma, neuromuscular disorders, and upper extremity paralysis. Dr. Gellman earned his medical degree from the Lewis Katz School of Medicine at Temple University. He completed his orthopedic surgery residency at the Hospital of the University of Pennsylvania and advanced fellowship training in hand and microvascular surgery at the University of California, San Diego, as well as additional orthopedic fellowship trained at the Perelman School of Medicine at the University of Pennsylvania. Dr. Gellman performs advanced procedures including minimally invasive and reconstructive surgery, arthroscopy, microvascular surgery, tendon repair and transfers, and PRP injections. He also serves as a clinical professor orthopedic surgery at Nova Southeastern College of Osteopathic Medicine, and we are very excited to have him joining us up here in Boca at Baptist Health Orthopedic Center. So welcome, Dr. Gellman.
Well, thank you very much.
Wow.
You make me sound impressive.
Pretty impressive. Wow, that was incredible.
Actually, we can add, I just received an appointment at FAU as a clinical professor.
Oh, congratulations.
Also. Thank you.
I was reading your bio and I'm thinking minimally invasive, and they talk about all the things that you do. I'm thinking that doesn't sound minimally invasive, but nowadays with technology, it truly is.
It really is. It's all relative. Before everything was done with large incisions, you'd stay in the hospital. I remember when I was a resident, we would admit people to the hospital a day or two before a joint replacement, and they'd stay in the hospital a week or two, get some therapy in the hospital and go home. Now they pull up out front, get on the elevator, go to the operating room, they have their hip replaced, and the next thing you know, they're on their way home.
It's incredible, the technology that's changed. And now you're at Baptist, and it's what a great hospital, what a great teaching facility, what a great community hospital.
It is. I'm very pleased and proud to be there. I was in private practice in Coral Springs for 20 years and decided that I really just want to concentrate on taking care of my patients and some research, some academics, and not worry about running a business anymore.
It's interesting because when you went to medical school, it was always about taking care of the patients, and then medicine became a business, and then you say, you know what, I really want to go back to focusing on patient care.
Right.
And technologies now make it so unique that you can really get in there and get out, less risk to the patient, more opportunities for healing and repairing.
Yeah, I think one of the biggest changes in hand surgery, a lot more of the procedures are done under local anesthesia, so patients don't have to go to sleep. And that's a big change because we did everything, and that came from Canada, really. And that had to do with their shortage of anesthesiologists. And so they were forced to do a lot of the procedures under local anesthesia. And what happened is it really caught on around the country, and more of the procedures are able to be done under local. And the nice thing about that is the patient can drive themselves in and drive themselves home.
Oh my gosh.
They don't need someone to bring them. It's amazing to me how many of the patients, and it's kind of sad in a way, when I say, well, if you go to sleep, you need someone to bring you and take you home, and they're like, well, I don't have anybody. And I think a lot of that has to do with people living so much longer that a lot of their family and friends are no longer around.
And they're taking care of themselves.
And they're taking care of themselves. And they're doing a great job, but they're living alone, and they don't really want help or need help, but they don't have someone that they can call up and say, hey, I need you to spend a day transporting me up and back to the hospital.
More independent. But I think the generations have become more independent. You do athletic injuries as well.
Correct.
What are some of the most common hand, wrist, elbow? Because as a hand surgeon, you're really working elbow down.
Correct. It depends. I mean, obviously we all know about tennis elbow. Tennis elbow, interestingly, many years ago I did a spot on ESPN Sports for fishing, because fly fishing is very similar to that motion for tennis, and so tennis elbow is actually very common in fly fishermen. And so you have tennis elbow, you've got golfer's elbow are very common. Football and soccer, you get a lot of wrist injuries. Pickleball is big with wrist injuries, and I didn't know this until recently, that to play pickleball you need special pickleball sneakers or shoes, and if you don't wear the proper shoes to play pickleball, your foot catches and you perch forward, and when you do that you put your arm out, and then they come to see me with a broken wrist.
Are you a pickleballer?
I've tried it. It was actually fun.
People say it's fun, but I know it's a great sport. A lot of people are playing pickleball, especially in Boca Raton in South Florida, but it's very injury prone. Knees.
I think a lot of it is
hips.
because the people that play are older, and they're grabbing a sport that's fun to do without going through the exercise regimen that they need to do to be running around. And so it's kind of the old weekend warrior.
An early diagnosis, for example, you're playing pickleball, you fall, you put your hands out. It hurts, it's sore, and they don't see you right away. When
Correct.
should people come? When should it be something that to get looked at, or ice first and then give you a call?
Excuse me. If you have swelling and or bruising, then you don't get bruising unless you've torn or broken something, right? If you fall, it might swell a little bit. If it swells, you've strained or sprained a ligament or something in your wrist. And usually that will, if it's minor, go away in a few days. If it doesn't go away within a few days to a week, you need to see someone. If you have bruising, you should see someone right away, because in all probability, you've torn something. And sometimes just the fact of getting in and getting immobilization, having that proper casting or splinting, will allow it to heal, rather than going on into a situation where you now have a chronic problem and it requires surgery.
Are you seeing a lot also of carpal tunnel, people on the computer? And I guess the other thing, I don't know what they call this, texting thumb?
Trigger thumbs. And
Are you getting a lot of that?
a lot of tendinitis, a lot of carpal tunnel syndrome. We do minimally invasive surgeries. There are a couple different techniques available. I do one that I like called endoscopic, where you make a little incision in the wrist and you put the instrument inside. You can see it on a camera on the screen, the inside of the carpal tunnel, and you pull the trigger, and as you take the instrument out, it releases the carpal tunnel, and that's been a big advantage. That's changed a lot. The recovery is a lot
That's what I've
faster.
heard.
Patients really, I have people that come to me and they're like, well, my neighbor had carpal tunnel surgery and they couldn't do anything for 6 months. I said they didn't come to us, because the way that I do it is different. And
It's a lot simpler, easier recovery than what it used
much
to be.
quicker recovery.
And what about, I know I've seen trigger fingers when you actually can't. I was laughing because Clayton was showing you his fingers and how some bend because of prior surgery. But people actually it gets tight here. It's like a tendon.
Well,
I know it's
the
a common.
tendon goes through a series of pulleys, like the eyes in a fishing rod. And if you think of when you're fishing, if you get a knot in the fishing line, it's not going to go in and back through that eye. If you have a swelling or inflammatory tissue that builds up on the tendon, the pulleys that you have in your finger are what help it bend, just like the fishing rod. And the same thing happens. It catches and it won't go through. start out with some cortisone injections and some therapy, and if that doesn't take care of it, then it's a simple operation to fix it, to release a pulley or clean up some of the tendonitis. It's a 5-minute surgery, and it makes a big difference.
And what other advancements have you seen? I know we talked about the carpal tunnel. We've talked about using some injections. Not everyone needs surgery. You do use some conservative care to start with?
Probably 80% of people get better with an injection.
That's remarkable.
The numbers are high. The other thing that has been a nice advance is patients that get a disease called Dupuytren's disease, where they develop a contracture of really it starts in the palm and it pulls the finger up. They can't straighten their hand out. We used to do a large surgery to take that tissue out, and the recovery was horrendous. Now, the technique that I like is called needle aponeurotomy, where you just basically numb the hand. You can do it in the office and just take a needle and divide the band, just like cutting a rope. And the patients leave 10, 15 minutes later, they can straighten their fingers out. They're really happy.
That's incredible.
Yeah, it's a nice procedure.
When my dad had Dupuytren's, and I remember he went with one of the physicians we were talking about, he injected it because the surgery 15 years ago would be horrible. He was a physician.
Right.
To recover from that, he couldn't see patients. What was he going to do?
Right.
But it's totally changed.
So, and you have the injection, which is an enzyme that is similar, I tell the patient, like battery acid. But what's interesting is the results of the injection versus the needle procedure at 2 years are about the same in terms of recurrence, but the needle procedure has almost very little pain, very little downside. The injection, the next day your hand is swollen up like a baseball glove, and it hurts.
That's incredible.
And it's also it's extremely expensive, the drug. In fact, they won't allow them to use it in Canada because it costs so much.
Have you seen, on the positive side, seeing patients at Baptist gives you more access to other therapies, other modalities, that there's a bigger team approach instead of being in private practice for you?
Absolutely. In fact, that's one of when I came to South Florida, I came here, I joined University of Miami as co-chief of the hand service, and I was there for a few years. When I left and went into private practice, the difference in Florida from medicine in some of the other states, particularly I trained in Philadelphia, I'm from Philadelphia, they don't have that same university hospital. It's all self-contained. You go into Baptist and you've got a cancer center and you've got radiation oncology, you have neurology, neurosurgery, you have all of these systems and departments that work together. And in private practice, you might have a radiation oncologist in Boynton, and you might have your hematologist oncologist in Coral Springs, and the communication's not there, and I think it really affects patient care. I think going to a place like Baptist really makes a difference. I think the patient care is much better. It's coordinated. Which
makes a huge positive difference on your outcome, on falling in fear and going to see a physician, and then thinking, even if, like you said, independent, what do I do now? What if I need to go get an x-ray? What if I need to get an MRI? What if I need an anesthesia consult? Pain medicine, pain management, it's all within the health system, and all your records now with EMR, it's all in one system. So you make your notes and you call a consult, and the consult could be down the hall in the next building, but it's all connected, which makes it a lot easier, not only for the patient, but for the physician, right?
Correct.
Less liability, less fear of your patient's not going to follow up, but what the next step would be. A lot of it goes into it that I don't know if people even realize, because you diagnose a patient and you need an MRI, and you're counting on someone scheduling it appropriately, the patient showing up, getting the reports from the radiologist. But with Baptist, it must be right at your fingertips.
It's all there. That's all there. And most of the time, it's all in the EMR, so that you know that, okay, you can make a tickler file, let's follow up, make sure they got their appointment, make sure they got it done.
What is it about hand, elbow, wrist that you love so much that you went into it?
My background before medical school was in biomedical and electrical engineering. So I'm an engineer. And the thing I liked about upper extremity surgery, and when I started, I really did the entire upper extremity. So I was doing shoulder surgery, shoulder replacements, elbow, wrist, hand, and it gave me an opportunity to kind of do big and small. I can do microsurgery, I can do free flaps, everything that a plastic surgeon can do, we can do. And everything an orthopedic surgeon, I'm an orthopedic surgeon, but everything that an orthopedist can do, I could do. And I wasn't interested in hips and knees, and so it was very appealing to me to get into that aspect of it.
And now you've seen how everything changes.
Yeah.
All right, we're going to take a quick commercial break. When we come back, more with Dr. Harris Gellman of Baptist Health South Florida. You can contact All County Healthcare at info@allcountyhealthcare.com or 954-717-7027. More to come, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to You and Your Doctor. I am Dawn Graubert. You and Your Doctor is sponsored by All County Healthcare, a Medicare certified home health agency. For more information, you can contact them at info@allcountyhealthcare.com or go ahead and give them a call at 954-717-7027. We are here live with Dr. Harris Gellman, MD. He is an orthopedic surgeon from the Baptist Health Orthopedic System right here in Boca Raton. We've been talking about his history, where he came from, training, advances in medicine. But now we want to talk about not just the bread and butter, but things that people don't talk about, the neuromuscular problems, different disorders that you can help through microsurgery and other aspects.
It's interesting. There are a lot of patients that fall into the disabilities with neuromuscular problems that patients don't know, and their physicians sometimes don't know what's available and what can be done. People that have cerebral palsy, a stroke, that have brain injuries, spinal cord injuries from car accidents, things like that. I mean, when you're stuck in a wheelchair, your entire world is what you can reach with your arms. If you can't use your arms, your world is even that much smaller. And it's really hard on these people. When I practiced initially, when I finished my fellowship, I took a position at the University of Southern California, and I worked at Rancho Los Amigos Hospital, which is a world-famous rehab hospital in Downey, California, right outside of Los Angeles. And I was there for 10 years. And we developed a lot of operations and published the results of all the surgeries that we invented when we were there. It was a great experience. But I brought that with me to be able to try to help these people. And I have one young girl in particular who had cerebral palsy. She couldn't turn her arm over, the typical posturing. and she now can go into a nail salon and get her nails done. She got married. She's really just through a series of operative procedures to be able to give her function, improve her function, but give her function.
It's amazing because I don't think people realize, because if you're born with cerebral palsy and you think the contractures is part of the diagnosis, that there's anything that you can do other than the wrist splints and keeping people comfortable. That you can actually go in and, what do you release?
We move tendons around. Sometimes you'll fuse a joint. Sometimes you even will do something, you can cut a bone and turn it, so that if you're stuck in a position and you want to put them in a functional position, you can actually cut the bone, rotate it, plate it, let it heal, and it completely changes their life.
Work with children as well, or do they have to wait at a
Yes.
certain growth point?
No, you can do it. I started out, I used to joke that my practice encompassed birth to death.
Because you think about, right, heaven forbid you have a child born with cerebral palsy, what do? Do you wait for them to become of a certain age of growth? Or if you can make them functional from an early age, they'll have such a much better outcome and life prognosis of functioning and doing things in school and playing ball and being integrated into the system a lot easier.
They need to be old enough to cooperate with the therapy program. That's really the main thing. And it's also an area where Botox comes in, because for a lot of the spasticity, what happens is someone will come in and you won't be able to tell what function they have or don't have, what muscles are working or not working. And when you use Botox and you paralyze a group of muscles, all of a sudden you see muscles that you didn't think worked are working. And so it helps you in planning surgeries for these people.
And what about stroke? Or spinal injury, things that are sudden onset, they're acute. What can you go in and how do you help those type of patients?
Same type thing. It's a combination of bony procedures and soft tissue, moving tendons around so that you can restore function in an area. It's a reconstructive procedure where they've lost a certain function, the ability to open and close their hand, and by moving, and now we also do nerve transfers. And so you can move a nerve from a muscle that's functioning, but you don't really need, okay, because you'll have there are a number of muscles that will do the same thing, function-wise. And so you can take a nerve from one muscle and put it into a non-functioning muscle and improve function that way.
And I'm wondering, you see a lot of things, a lot of technology with electronic devices and people that have paralysis and they're using their hands or they're using the sip and puff wheelchairs. Does it help with them with their communication skills as well when you can actually reach the iPad or reach?
Absolutely, absolutely. I think that's a big part of it, is being able, again, to interact with your environment, because that's what's missing, that interaction. And I think it also helps their self-esteem an enormous amount.
Right, to be able to work with the adaptive equipment that you have.
Right. Yeah.
And rehab, how I know Baptist, with your doing surgery there.
They have the Gloria Drummond Rehab Center, which is phenomenal. And they have a great group of, I use certified hand therapists, and they have a great group of therapists. But the whole facility, it's really impressive. I mean, just to go take a look at it, people should do that.
Which is another great reason to contact you and to work with Baptist. What's the best way for people to reach out to you or the health system?
I guess the easiest thing is just to call the appointment number. It's 561-955-6784.
And you're located in the Boca campus?
I have two offices. I'm in the Cooperman building, which is right across the street from Boca Regional, and a second office that's the Boca Regional campus, which is at Powerline in Hillsborough.
Okay, so you're local in two places. So people who are in South County have an easier place to go, and if you're a little further north, you're more comfortable with the hospital setting, you can reach out to Dr. Gellman right there. All right, before we wrap up, fun fact, you used to have a radio show.
I did.
And what did you talk about on your radio show?
I interviewed, it was when I was at the University of Arkansas, I ran their hand program, and somehow or other I became one of the spokespeople for the university, and I would interview the different doctors in different departments so that people could, it was a call-in show, and we would interview them and then people would call in and ask questions.
Well, maybe we can get him back in, Ryan, and he can do his own call-in show. Ask Dr. Gellman.
That would be
or
great.
hand surgery with Dr. Harris Gellman. I don't know. We'll come up with a fun thing to say. Dr. Gellman, it's been a pleasure. Thank you for joining us. Thank you for tuning in and listening to You and Your Doctor, sponsored by All County. Again, you can contact them at 954-717-7027, allcountyhealthcare.com for all your Medicare needs. Have a great evening, everyone. I'm Dawn Graubert, and we will see you next week.